This is part 2 of topic 10 of the autonomic nervous system, beginning with slide number 24. What we're going to talk about here with this slide, the neurotransmitters released by the autonomic nervous system. And so for both parasympathetic as well as sympathetic, the preganglionic neurotransmitter that's released is acetylcholine. Acetylcholine is released by cholinergic neurons, so that makes these preganglionic neurons cholinergic. Acetylcholine is released at the synaptic kernel of all preganglionic neurons, that is sympathetic as well as parasympathetic. The postganglionic parasympathetic nervous system releases acetylcholine from these postganglionic parasympathetic neurons, that is at the second synapse where they're innervating their target organ. Now, in contrast, norepinephrine is released by adrenergic neurons. So adrenergic neurons are neurons that produce norepinephrine. Cholinergic neurons are neurons that produce acetylcholine. The sympathetic nervous system releases norepinephrine from these postganglionic neurons at the second synapse, the target organ. However, there's caveats and exceptions. There are some postganglionic sympathetic fibers that innervate sweat glands and blood vessels of skeletal muscle that instead of releasing norepinephrine, they're releasing acetylcholine. Now, the receptors that acetylcholine is going to bind to are two types. One is a nicotinic and the other is a muscarinic. Nicotinic receptors are referred to as ligand-gated ion channels. That is because when acetylcholine binds to nicotinic receptors, you activate this ion-gated channel and you get an influx of sodium ions into that neuron that's being stimulated by acetylcholine. Muscarinic receptors belong to a big superfamily of receptors called G protein coupled receptors. That is, the receptor is coupled to a G protein, and these G proteins could either be stimulatory or they could be excitatory, and we'll talk about that in a second. So the nicotinic receptors are located on all postganglionic neurons, as well as you'll find nicotinic receptors on skeletal muscle and nicotinic receptors on the adrenal medullary glands are being innervated by, for example, the sympathetic nervous system. Muscarinic receptors are on parasympathetic effectors, such as the heart, for example, and receptors of some sweat glands. Now, the adrenergic receptors bind to norepinephrine and epinephrine. And so there are two types of receptors, those are alpha and beta shown here. They are further divided into alpha 1s, beta 1s to beta 3, and usually have opposite effects than the alpha 2 receptor. Again, acetylcholine binds to postganglionic cells as a nicotinic receptor. It's going to cause excitation. There's also muscarinic receptors, but the one I want you to focus on is that on these postganglionic neurons is that it's the nicotinic receptors that's going to elicit the action potential. The muscarinic receptor is just going to modulate that, either enhancing the excitability or decreasing excitability, depending on the muscarinic receptor. Acetylcholine targets receptors on target cells is, again, muscarinic. It binds, and so you get excitation or inhibition. Muscarine acts like acetylcholine. It's found in a poisonous mushroom. It acts on muscarinic receptors. Norepinephrine activates both alpha and beta receptors. In terms of selectivity, the agonist isoproterenol, which is selective for beta receptors, and alpha receptors. Isoproterenol is an agonist, meaning that it's going to stimulate beta receptors. Alpha receptors, again, are divided into two classes, alpha 1s and alpha 2s. Alpha 1s are located on postsynaptic targets. sympathetic nervous system. Alpha 2s are found on these presynaptic terminals of cholinergic nerve fibers. And so I told you that these muscarinic receptors, didn't say much about the alphas, but the alphas also belong to that superfamily of G protein coupled receptors. Okay, and so receptors coupled to G proteins. And so this shows the receptor, the alpha 1, is coupled to this G protein called GQ or G11. And activation here is going to liberate 2 second messengers, inositol triphosphate or IP3 and DAG. And this is going to result in generating a stimulatory effect. Alpha 2 receptors are coupled to a GIGO. These are inhibitory G proteins, and inhibition here is going to inhibit this enzyme called adenylocyclase. It's going to lead to an activation of a potassium channel, causing hyperpolarization. Potassium is going to leave the cell, and this is going to produce inhibition. Beta receptors, there are beta 1, beta 2s, beta 3s. The G protein they're coupled to is a stimulatory G protein called GS. So stimulation of beta 1s is going to activate adenylocyclase, and you get a stimulatory effect. And what you're producing is something called cyclic AMP, which is a second messenger, which is going to lead to a stimulatory effect, downstream stimulatory effect on this post-ganglionic cell. Muscarinic receptors, again, they're G protein coupled receptors. The M1, 3, and 5, they're coupled to GQ, G11. And so their second messenger is going to be IP3 and DAG. They're going to be, when acetylcholine stimulates, they're going to be excitatory. M2 and M4, in contrast, are coupled to GI-GO. And so inhibition, they're going to cause inhibition of adenylocyclase, decreases the production of cyclic AMP. They're going to activate potassium channels. Potassium is going to leave out. These are different potassium channels than the voltage-gated potassium channels that we talked about in terms of action potential. And all this is going to lead to inhibition. So M2, M4 are inhibitory. 1, 3, and 5 muscarinic receptors are excitatory. Nicotinic receptors are found on autonomic ganglia as well as the adrenal medulla. They're excitatory. They're going to cause depolarization, and so you're going to increase the firing of that postganglionic either sympathetic or parasympathetic neuron. And this firing is due to your increasing the permeability to sodium and potassium. There are different subunits that make this up. I don't want you to memorize this. The only reason why I show this is to show that the nicotinic receptors that are found on skeletal muscle, called NM, have different subunits as compared to the nicotinic receptors that make up your neuronal nicotinic receptors that are found, for example, on the autonomic ganglia. And so this gives some selectivity. And so you could use specific drugs that can act specifically on skeletal muscle and have no effects on peripheral neuronal nicotinic acetylcholine receptors. In terms of this slide just indicates where these receptors are located. So this is your myelinated preganglionic neuron releasing acetylcholine onto nicotinic receptors. This happens to be a postganglionic sympathetic neuron. You get release of norepinephrine. Norepinephrine is going to have this effect on its target organ. This could be, for example, a cardiac muscle that's expressing beta receptors, and the effect is going to be stimulatory. Here, what we're showing is a preganglionic neuron, again releasing acetylcholine onto a nicotinic receptor. You're going to get release of acetylcholine. Acetylcholine is going to act on this target organ right here. In this case, this is still sympathetic, and it's going to act on either M1 or M3 receptors on the target. And so this is a case of sweat glands that are being innervated by the sympathetic nervous system. Parasympathetic, you're releasing again acetylcholine. Is acting on a nicotinic receptor on this postganglionic parasympathetic neuron. this postganglionic parasympathetic neuron is releasing acetylcholine. Acetylcholine is binding to, for example, again, cardiac muscle. It's going to interact with the M2 receptor. The M2 receptor is inhibitory, so you're going to get a decrease in heart rate and contractility of the heart. Okay, autonomic reflexes control most activities of the viscera, glands, and blood vessels. They're influenced, that is, they're regulated by the hypothalamus, so the hypothalamus can either increase or decrease either sympathetic or parasympathetic outflow from either the cranial nerves that we talked about that are parasympathetic or the sacral, as well as influencing the sympathetic output that's found in from T1 to L2. So it's the hypothalamus that overall has an effect. Okay, and so here it just gives an example of a autonomic reflex. Another autonomic reflex are the baroreceptors. These are mechanical receptors that measure pressure. They're found either in the aortic arch or the carotid sinus, and so an increase in blood pressure is going to increase their activity, increase their firing rate, and their sensory afferents are going to project into the CNS to either activate the pressure center or decrease the pressure center, resulting in a decrease in blood flow via decreasing sympathetic tone, as well as decreasing heart rate. And so increase in blood pressure increases active potential from these baroreceptors. They're going to activate the depressor center, which is located in the patella. And so what's going to happen here is they're going to synapse with these preganglionic sympathetic neurons, and they're going to decrease their excitability. So you're going to decrease this outflow from T1, from the sympathetic outflow. And so you're going to decrease sympathetic tone. And by doing that, you're going to decrease the decrease heart force and rate of contraction. In addition, because your vasculature is generally controlled by your sympathetic autonomic nervous system, if you're decreasing your sympathetic output, you're also going to decrease sympathetic innervation to your vasculature, and that's going to lead to it's going to decrease vasoconstriction, so you're going to get vasodilation, and you're going to decrease in blood pressure. And so a decrease in pressure, like, for example, in a hemorrhage, is just going to produce the opposite effect. And so here, this kind of diagrams the baroreceptor reflex. You have your afferents coming from your baroreceptors that are coming in via the glossopharyngeal nerve as well as the vagus nerve. So they're going to have the afferents coming from these baroreceptors. They're synapsing into the cardiovascular center to either activate or decrease the cardiovascular center, either the depressor or oppressor centers. And so on one hand, what's going to happen is that you're going to affect sympathetic tone that's innervating the heart as well as the vasculature. In addition, if there's an increase in blood pressure, increase in the activity of your baroreceptors, you will also activate your parasympathetic, that is the vagus nerve. The vagus nerve will innervate the heart. Again, it's releasing acetylcholine. Acetylcholine acting on M2 receptors is going to cause a decrease in heart rate and contractility. And so sympathetic tone, like I said, generally is what's regulating your vasculature. So increase in sympathetic tone is going to cause vasoconstriction. A decrease in sympathetic tone, vasodilation. And so here, what you're looking at is an example of control. Here you get epinephrine, and this is going to increase contractility. If you block it with propranolol, which is a beta receptor blocker, you're going to decrease the effect of epinephrine. But you notice that you don't have much of an effect in terms of arterial, and that's because of arterial, the vasoconstriction or the sympathetic innervation is not mediated by beta receptors. Instead, they're mediated via alpha-1 receptors. In terms of the heart rate, you notice that the heart rate is decreased in the presence of propranolol, so it blocks the effect of epinephrine. And again, because the heart rate in terms of the heart, it's the beta receptors that are involved in terms of contractility and heart rate. Okay, and so propranolol will block the effect of epinephrine here. And so here, just to show that the alpha receptors are indeed working in the vasculature, what you're looking at is treatment of phentolamine. Phentolamine is a drug that blocks alpha receptors, both alpha 1s and alpha 2s. And so when you give, and so you're looking at heart rate right here, 135 over 85, give phentolamine, you get a decrease in blood pressure. And so it goes from 135 over 85 to 128 over 50. But notice that you get an increase in heart rate. And the reason why you got an increase in heart rate is that, remember, the alpha 2 receptors are presynaptic. And so this phentolamine will also block that presynaptic alpha 2 receptor. And blocking that presynaptic alpha 2 receptor is going to increase the release of norepinephrine onto the heart, leading to an increase in heart rate. Okay, and the reason why you're not blocking that increased release of norepinephrine on the heart rate is because the heart has beta receptors, not alpha 1 receptors. Okay, and so phentolamine is not going to block these beta receptors. All right, and so dual innervation, they could either be synergistic or cooperative. They could be antagonistic or cooperative. This an example here in terms of with the eye. Here is antagonistic, and so adrenergic stimulation is going to cause dilation of the pupil. Okay, cholinergic innervation is going to cause constriction. So when you go see your eye doctor, one of the things he gives you is an antagonist of the parasympathetic innervation, and this is going to lead to an imbalance of autonomic innervation. So your sympathetic is going to be innervating the eye, the parasympathetic is going to be blocked, and you get dilation. This enables the eye doctor to look in and look at the retina, for example, for any kind of dysfunctions and things. This just kind of summarizes the dual innervation between sympathetic and autonomic nervous system. It could be you could have cooperative effects. In addition, an example here is looking at the effects of sympathetic and parasympathetic on your salivary glands. Again, the hypothalamus controls the autonomic nervous system, both sympathetic and parasympathetic. This just shows a diagram of that type of control. And so lastly, this just talks about kind of a generalization of sympathetic and parasympathetic innervation. And so follow this, gives you an idea as, for example, like parasympathetic is more important for resting conditions. There's an acronym, SLUDD, for salivation, lacrimation, urination, digestion, and defecation. And so this is the end of Part 2 of Topic 10, Autonomic Nervous System.